Dr. Anthony Fauci, chief medical advisor to President Biden and the top infectious disease doctor at the National Institutes of Health, joins us now from Washington. Dr. Fauci, good morning to you. We have a lot to talk about in terms of future response to the pandemic, but because both you and Dr. Birx gave reflective interviews recently, I want to start with a recent past. Dr. Birx told Face the Nation yesterday that it is a terminal event in her career working on President Trump's coronavirus task force. She's going to retire. How do you think her work should be remembered?
Well, she was really, put in an incredible amount of herself into this under very, very difficult circumstances. The difference between the situation I was in and she was in, she had to essentially live in the White House. That's where her office was. And when she was trying with the team, myself and Dr. Redfield and others, to try and get the medical public health issues on the table and addressed, there were a lot of opposing forces there. And it was a very difficult experience for her. I thought she articulated it really well in the interview that she had, where, particularly when situations when people like Scott Atlas came into the White House, who essentially was the antithesis of what she was trying to do. Yeah. And it made it very, very difficult for her. So that's what I think she meant when she said it was a terminal event.
She said that there were two streams of data moving to the desk of President Trump. In addition, she said there was no full-time team inside the White House working on the coronavirus. Two alarming bits of information I hadn't heard before. What was your reaction to that?
Well, I lived through it with her, so it was just shaking my head saying, yes, right. Well, first of all, there wasn't a full-time team. I mean, she was, getting up at 3 o'clock in the morning, collecting the data, presenting it to people. But I think the important point that she made that really is critical was the two opposing forces, because she was trying to get information into the president on a regular basis, but the president was getting information from other sources, friends on the outside who would call him up, or people who would have input into it. And that gradually attenuated her influence to the point where she didn't really see him very much anymore. Yeah. That's what she was trying to explain, right?
You said the 1 million doses per day in the first 100 days was a floor, not a ceiling. Just doing some simple arithmetic myself, to get to 70 to 85% vaccinated Americans by the end of the summer, early fall, we would need to be at about twice the rate we currently are at, 1 million a day, and the goal of the Biden administration. Right. So when you talk about a ceiling, is 2 million a day plus, is that possible based on what you see so far?
No, I think it is. If you listen to what the president said, he said, we're going to try and get as many doses into people as we possibly can, as quickly as we can. He set a goal a little bit ago, and hopefully we'll meet and surpass that goal. That's the point.
But I mean, is it only
just because someone gives?
Yeah.
Just be.
Hope is an odd. Hope is an odd thing to lean on at this point. I mean, can we do it? Do we have the manufacturing coming online? Do the executive orders from last week, the Defense Production Act, does that help us reach that goal, and how?
Yes, yes, and yes. Yes, we can reach it. He set an original goal of 100 million doses in the first 100 days. And as I've said and others have said, that's a floor, not a ceiling. It's a reasonable goal. It's not, it's not easy to get doses from where you go in the vial all through the transportation into people's arms, particularly when you get out of the realm of giving it in a hospital or giving it in a nursing home, and you've got to go out into the community, particularly underserved communities, to get it to people. So if people think that's easy, it's not. It gets hard, and it'll get harder. Do we think we can do it? Absolutely, we think we can do it.
Let's touch on the travel ban, because the reporting we have is that today the Biden administration, Joe Biden himself, will announce restrictions on travelers coming into the U.S. from the U.K. and also, crucially, South Africa, where there is a mutation that scientists are concerned about. How effective do you think a travel ban will be, given we recall President Trump instituted a travel ban on China, and it didn't seem to work out too well?
Well, first of all, it clearly will be helpful. We have concern about the mutation that's in South Africa. We're looking at it very actively. It is clearly a different and more ominous than the one in the UK, and I think it's very prudent to restrict travel of non-citizens. But there's also something else that we didn't have before, is that people coming into the country are going to be required to have a test before they get on the plane. When they get off the plane and land here, they're going to have a quarantine as well as a second test.
If I can give you a touch of good news as you go, Dr. Fauci, and we appreciate you coming. Spring training starts in 3 weeks. Baseball season is on its way. Thank you very much.
Yes, thank you. Thanks a lot. Good to be with you.